pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Clock 7:01. Start. Sue is not going to make it. I'm not sure why, but she's not going to be here tonight. We're going to have to handle it early on our own without her. Did you have a chance to look at the minutes?
Yes, I did.
Any corrections?
I do not have any corrections.
Make a motion to approve the minutes of September 21st, 2016.
Oh, yeah. Approval of the agenda.
Approval of the agenda. Motion to approve the agenda.
Second.
All in favor?
Aye.
Aye.
Supposed to be changed.
Correspondence. I've got one item. And I want to
Wait,
show you.
so hold on.
I'm sorry?
Was there supposed to be a change to the
You're
agenda?
going to change something in the agenda?
You've got it pretty well. Okay, you've got it pretty well there, but you're right. Why don't we do that? I'd like to. That's right. We haven't approved the agenda. I skipped right over that. I'd like to change the Middlesex Hospital parametric service up to right after the approval of minutes.
Fine.
And I'll give Jim a chance to get in, do his presentation, and then head for home.
So that'll be 3A.
Yeah, that'd be 3A.
Okay.
And with that said, now I'll make a, we did the agenda, didn't we?
Yeah.
And now I'll make a motion to approve the minutes of September 21st.
Second.
Any discussion?
They look fine to me.
Okay. All in favor?
Aye.
Aye. Okay. And with that said, Jim, would you like to come up and do a presentation? This is Jim Santa Cruz. He's the director, or the manager of the emergency services at Middlesex, and the paramedic whole thing. And I think he can give us a full rundown, a full presentation on just how that works and what it's all about.
Sure. Thank you so much for having me. I appreciate it. I spoke with Selectmen at a meeting that we had last month up at the hospital, and I know he kind of came in when we had discussed this with Mark before, and so tried to recap it. But there's a lot of information there. Since then I've also spoke to a couple of citizens that have reached out to me and given me a phone call and provided some information back and forth. And so what we're talking about is late last year, about November, December, the hospital approached the towns in the community in which we serve, Middlesex County, and asked them to get into a cost share with us for the paramedic program. The hospital paramedic program, if any of you have seen, our trucks are four-wheel drive vehicles that are stationed at our emergency departments around the county. And so they're not ambulances. What we do is we provide intercept service, or we meet the ambulances on the way to the hospital, or we're dispatched with 911 to the scene of calls. So we've been doing that since 1987, so almost 30 years, that the hospital has provided that service without charging the towns for that service. In the state of Connecticut, each town is obligated by law to provide a designated first responder, a designated ambulance service, and a designated paramedic. So in this town, your first responder and your ambulance are both the same entity, which is East Haddam Ambulance Service. The fire department is not a recognized medical responder in the town, not at this point anyway. And Middlesex Hospital has been the designated paramedic service since that time. So the hospital operates the paramedic program. It's about $1 million a year loss that it operates under. And that's been that way that's operated under loss since the beginning. And the reason that is insurance payments and reimbursement. So the rates for any ambulance, including East Haddam ambulance, that are charged are set by the state of Connecticut. So every year, we have to go through, any chief of service has to go through a process that's laid out by the state of Connecticut Department of Public Health. And we have to fill out all this paperwork and give them financial sheets and everything, send it to them, and then they set a rate schedule every December that's put out for the next year. So that's the rate schedule that we follow and that we have to follow. Middlesex Hospital and actually East Haddam Ambulance use the same billing agent, which is Shared Response Health Services in Killingworth. And we have an agreement, it's called a bundle bill agreement, which we have with all of our towns, or all the ambulance services that we work with. East Haddam Ambulance, since it's not an actual town entity, so that's with that association. Some towns that we work with have fire departments that are part of the town, others are third agencies, lots of different makeups depending on where we are. So, why do we need a bundle billing agreement? The way that Medicare specifically, and Medicaid, but mostly Medicare is set up, is they will reimburse for ambulance services and paramedic services, but only in a certain way. So if we bill, for example, a rate, let's say that's set by the state, so an average charge for what's called an ALS 1 or paramedic care, where you can put in an IV, put the person on a monitor, maybe give 1 or 2 medications, that's one schedule. Then there's another schedule if beyond that we go to other more invasive procedures where we intubate people or get into people that are into cardiac arrest or just basically using more equipment, they qualify that as an ALS 2. So those are both different charges that are set by the state. So on its face, the paramedic ambulance bill together would be about $1,288. But Medicare only allows about $464 for that. So they'll get the bill basically for $1,288, but they'll only pay out $465 round. So out of that, what happens is, with this bundle billing agreement, it is something that's sanctioned by CMS, or the Center for Medicare Services, which is Medicare. That bundle billing agreement allows East Haddam Ambulance to submit the bill to Medicare at the higher rate, the advanced life support rate. And so when they submit that bill, they get the check for the $465, and when that comes back, a report called the splits report is generated. And off that report, it says this is how much the ambulance gets, and this is how much the paramedic gets. We get, the paramedics get on average for a Medicare car, or for every Medicare car, $73.48. So, if you look at the number of calls that we do and how much it costs to do business, it's easy to see where we immediately run into a loss. It costs more than that for us to operate an hour, just having a paramedic sitting there not doing anything. So if we were able to be reimbursed, especially from the government at that higher rate, or the regular rate that the state says that we can bill for, then there really wouldn't be any issues and everybody would be doing okay. But the way that it's split up, that $400 almost that the ambulance gets sounds like enough for them, but that's not a lot for them either. That really takes a lot for them to staff an ambulance, and it's more expensive to run a regular Chevy Tahoe at times. So, based on that premise, the hospital has accepted this loss for years, and we've kind of gone along. We run a tight ship. I am the manager of the program. I'm also a paramedic on the street. I don't have an assistant. I don't drive a car. I don't have a fuel budget. I don't have any of that kind of stuff. It's a pretty tight ship. We're a flat structure. And we're also, on top of that, probably the highest quality paramedic service around in the state, bar none. And we have, since our paramedics work the way we do, our system is really called, it's a regional system, because we cover really just about the whole region. And that's actually the most cost-effective model for people to have. If you look at towns that have their own embedded paramedics into either their fire departments or into their ambulance service, it's extremely expensive. They are usually within just the borders of one town or municipality. And on top of that, their patient contacts, or the amount of calls that they're doing, is usually lower per paramedic. So what that means is you're going to get somebody that doesn't have that level of experience as our people do, that do a higher level of contacts. All the calls that we do are 911. All of them are usually fairly serious, or at least quantified to be advanced life support, which is determined by the 911 call. So the hospital, over the past several years, has been as you've all read in the papers, part of a tax from the state onto not-for-profit hospitals, which I think it was about 3 years ago now that they started doing that. And so that went from something that, of course, wasn't budgeted for at the hospital, from several $1 million to this year we'll be paying $21 million in this tax, kind of out of nowhere. So this year they were able to get back from that tax several $1 million, which is good, because in the past the governor had said he was going to give the hospital some of this money back, but he had not. So this year they did get several $1 million back, but it's still eclipsed by the total payout. So what that has to do with us is when the hospital is basically faced with this huge tax and just a whole changing environment for them, they need to look at everything, the way that they do business and all of their programs, and especially things like community benefit programs, like the paramedic program really is, and to see what they can do differently and what they can do better. So they took a look at the paramedic program, and we looked at how much we're losing compared to the service we have. We're not in a position where we want to or could really reduce service. We have a good mix right now of how the system works and how we are allocated, and so any kind of reduction would really negatively impact the system. So if you look at the bill, if the bill is $460, I should say the check that comes in, kind of the natural thought is, well, why don't we just ask for a little more out of the ambulance bill and kind of even that out a little bit. Well, the problem there is that that would definitely negatively impact the ambulances in each town, and then they would end up in this room looking for more money from the town just so they can operate and recruit volunteers and the like. So it really wasn't a good option. So the hospital still wants to stay in this arena and still wants to provide the service. They feel that it's a good thing to have high quality care from the beginning of the problem to the end. It's just better for outcomes and better for people. So what they did is came up with a cost share idea, which would be a per capita charge for the municipality, which is $1 per year per resident for the first year, escalating $1 per year for 5 years. So for the town of East Haddam, we have
126.
So $9,126 for the first year and going up per year up to the 5th year. So what we did is get to and even at the 5th year, that equals to not even 50% of exactly what the total loss would be. So the hospital would still be on board and still be paying the lion's share for the program and for the debt. On paper, we actually take in and we bill out just over $2 million for total bills and everything for our services throughout the year. But what we get back is so much smaller, and it costs about $1.3 million to run the program altogether. That's pretty much everything soup to nuts except for capital costs. And capital costs are our paramedic trucks and like our heart monitors. Heart monitors are about $34,000 a piece. The paramedic trucks, we budget about $65,000 a piece for those, and we buy those stock off the lot, and we bring them to local vendors to have things done. We find it's a lot cheaper than just going to a dealer that sells fire trucks and ambulances and buying something off the shelf. Those are usually 6 figures and up. So we use local vendors. We go to Whalen. Whalen actually donates all their lights and service to the hospital to put those on the trucks. That's a huge savings for us. They've done that for 30 years. So it's a lot cheaper to do it that way. That's how we've always done that. So we presented this to, I think it was January of last year, we presented it to, we put out an invite to all of the municipalities, to the chiefs of services, their ambulance, fire departments, police departments, anybody who was touched or involved with this, to start the discussion with the municipalities. And what we did is we worked with the Council of Governments, the River Cog, to come up with an agreement, a contract that was agreeable to them. As a unit, the selectmen of the River Cog formed a River Cog paramedic committee to work on this agreement with one of the attorneys from the towns of Westbrook, town attorney, I believe, who worked on this agreement with our attorney, went back and forth just to come up with the language. And then as of July 1st of this year, that contract went live. So one of the questions that we had that was asked to us in one of our meetings, and we were asked to go around, we went to pretty much every town's meeting like this, or a finance meeting, or a mixture of the two, and gone around to answer questions and things. One of the questions that had come up at our original meeting was, okay, well, we get it, we hear what you're saying, but what if we don't do it? What if we don't sign on to this? Well, as I said in the beginning, each town has to, by state law, designate these levels of responders. So as the designated responder for East Haddam, back when paramedics started in this area, the hospital was given a piece of paper like the ambulance has from the state, which is a primary service area agreement, which says that this is the town that you will cover, you're responsible for covering this town, here you go. So we hold that PSA. We don't have any desire to just give it up. If the town said, hey, listen, this is what we want to do, we want our PSA back, the hospital will certainly listen and discuss that with the town and do whatever's best for the town. That's what the town wants, and the town will have. So we don't have any interest in saying, here you go, here's this, you guys figure it out. If there's an arrangement that the town figured out was better for them, then that's fine. Everybody's certainly encouraged to look at options and things like that. But the hospital wanted to stay in this arena and to keep this whole. So that arrangement went out. The question was, what do you do if this doesn't happen? So we weren't in the position to say, well, we're just not going to come anymore. We're obligated to come. So even if we don't pay and you call 911, we're coming, regardless. That's just how it's going to be. So what the hospital decided was, if you remember that bundle billing agreement that I had mentioned, what that does is that keeps the paramedic bill away from the Medicare patient. So without that arrangement, and there's places in the state that don't have that arrangement, without that arrangement, the paramedic bill, which in and of itself is not recognized by Medicare, if I sent it directly to them, or a billing agent sent it directly to them, they would just kind of move it off to the side. So that bill would go directly in its full amount right to the Medicare patient. So right now, the Medicare patient doesn't see usually any bill unless they've got a different type of Medicare, where they may have some kind of a copay or something that exists today, where they have their secondary take care of, depending on different level of coverages. But now there's no bill that comes from the paramedics that goes to residents, and there won't be going forward with this. But that's what the hospital said, well, if we can't get this dollar per person and have the town buy in this way, then we don't have a choice, but we're going to have to unravel, or basically get out of this bundle bill agreement, which is a 90-day clause in it for both sides to heave ho if they so choose. And that was kind of it. That was all the powder that we had at that time for if the towns weren't going to sign up to do it. The towns decided to do that. We have a couple towns that haven't paid yet or whatever. We're still in discussions. One of them was Deep River. We know that there was an unfortunate event in Deep River with Dick Smith. So we're working on educating them and bringing them up to speed. But other than that, the contracts have gone out and been signed, and that's where we are at this point. And some questions like this have arisen from folks, and actually the calls that I have got were exactly that. Folks that were concerned that people from Medicare who had Medicare just would all of a sudden receive a bill, or that it would be free. And I can assure you that's not free. Nothing's free. But with that, take any questions anybody has. Yes, ma'am.
Cover Medicaid husky patients as well?
So nothing changes for Medicaid. The bundle billing agreements don't cover Medicaid. Medicaid is something that we had to work out a special arrangement to get a number from Medicaid to be able to bill Medicaid to get any kind of reimbursement from them. So yes, that's covered.
And it doesn't cover private health insurance patients?
Private insurance is not under the bundle bill. That's separate, and always has been.
So the only person that's going to receive the benefit from this is a Medicare patient? And how many, we don't have 9,000 Medicare patients in town. How many do we have?
So no, that's where the confusion comes in. It's kind of a crossing of the two different things. This is for, the purpose of this is for the paramedic service in itself. So to have that service available if somebody calls 911 and needs a paramedic, that's what it's for. So it's for any resident or people going through town that need a paramedic.
But you just said that a private health insurance patient who calls 911 is going to get a bill. The only person not getting a bill is the Medicare patient.
That's the bundle billing agreement with the ambulance that we've had for many, many, many years. This is the paramedic service agreement, the dollar per capita, which is to have the paramedic service for the town.
So no one will get a bill for paramedic services.
That is not correct. That has nothing to do, it has nothing to do
You're talking in circles.
with the bill.
So who's getting a bill?
So the bundle billing agreement in itself, okay, that is something that we have with the ambulance service. So the Medicare patients basically don't get that bill. It works in part for that. If you have, let's say, Aetna or private insurance, you will still receive a bill as you would have last week, last month, last year.
And Medicaid patients will as well.
I guess it would depend on the plan, but usually not. That usually is something that we submit directly to Medicaid, the state.
And Husky Medicaid, you submit that, that's part of the bundle bill?
Correct.
So back to the question then how many, so if you have private insurance, you're getting screwed on this deal basically.
Right, because if you have a high deductible, then you've got to pay the bill.
Right. So how many Medicare patients are there as opposed to the 9,000
Residents in town.
It really doesn't matter. It's this.
It does matter.
No.
It does matter.
Well, actually, the dollar per capita, again, is for paramedic service in general. So it's for everybody.
Well, the paramedic has to come
It has to come
anyways,
regardless.
so it's
Right.
really not.
And there's a
Not.
cost for that. What we're saying is that there's a big cost for that.
Right, we're
And-
paying it.
And I'm paying it, because I'm not a Medicare patient and I'm not a Medicaid patient.
Actually, you're not. Right now, you're not paying it at all. If you use the service, you get billed for it. That's correct.
Right.
But there's a cost for having the service and for being ready. There's a cost for keeping fire engines in a bay. And there's a cost for keeping an ambulance and for having that staff and people trained. And it costs a lot of money to do that. And it's a
The
loss.
ambulance isn't the paramedic service. They're two
No,
different.
I know, but I'm trying to contrast that it's not free and then all of a sudden you just come and pay for service and that's it. There's a cost to have that for the towns.
Right, but I still pay for it regardless of the cost, even the dollar per person. I still pay for
Right.
my service. Yet the person sitting next to me who might be a Husky patient or a Medicare patient pays zero. So where's the benefit to me who has to help with the cost share? If we don't have 9,000 residents in town that are Medicare eligible or Medicaid eligible. Not at all. So why are we
Right.
paying $9,000?
That's an option.
Especially if I'm not getting any benefit
Sure.
from it, or the regular citizen who has regular health insurance.
Sure.
Or no
That's-
health insurance.
That's something that the town could discuss and say, listen, we don't want to do this. We want to get out of this bill, and that would be up to you and the town to
And then
decide.
everybody would just have to pay a bill, right? If we don't bundle this stuff, then everyone pays their bill. Medicare, Medicaid, me, person with no insurance,
It would,
which
it
seems to
would,
be fair across the board.
it would change it would change that perspective, right?
My question is, didn't the hospital threaten to put on the bills if we didn't agree to this, that you would be paying a lower rate if the towns had bundled?
They said they were going to put a cover letter in there that said that if the town had signed on to this agreement, this bill wouldn't end up in your mailbox, right? Yes, sir.
Yeah. Go ahead.
Okay, explain, maybe people need to understand a little bit. Should it be unbundled, the agreement, the Medicare patients who are, for the most part, elderly, fixed income, don't have any, have a lot of expendable cash. Is it correct that they will receive their normal bill from the ambulance, which is about $390? They will also receive, depending on the services provided, a $401 bill for if you guys just show up and don't do anything.
Yeah, they would.
And
They would receive a bill.
$767 bill if support is given,
Right.
of
They would
which
correct.
Medicare would only cover the $390 ambulance bill
Right.
and not
Basically,
cover,
yes.
so they'd be stuck paying if services were rendered, the senior citizens of the town that, probably use advanced life support more than anybody else would be stuck with $767 bill.
Correct.
Okay, well, I have a question to that, because I'm disabled, my husband's retired, we're on a fixed income, but we get stuck with the bill. So you're segregating the population, is what's happening here.
I think everyone's on a fairly fixed income.
Reduced.
Jim, one thing that's puzzled me on this, and the way I understand it, is that a year ago, if you received the service, you'd have a deductible, you'd have a copay, whatever, and it essentially largely covered, but there'd also be that copay and deductible.
Yeah, nothing's changed.
And today, if for that same service, you'd get the same exact bills that you got a year ago.
Yeah, nothing changes.
Nothing has changed for anyone. And what
Nothing
would
has changed
change,
for anyone except for
what
the,
would change is Medicare people would suddenly get hit with a very, very steep bill. People are really in deep trouble in terms of paying it.
so yeah, nothing has changed. If the town decided not to go into the agreement for the dollar per capita agreement, then the hospital would unravel that bid, that loan bid.
And the only ones that would be whacked at that point.
Would really be those ones.
I mean, for everybody else, it's all the same as it had been.
Correct.
Nothing changes at all. So it's strictly the Medicare people that we're looking at.
Really, yes.
The report that I had indicated 149, which was somewhere between $59,000 and $108,000 that they would have been billed or would be billed for that same number in the coming year. So, you know, that's kind of what we're looking at.
I have just a clarification question. So, for a Medicare patient, you're willing to accept the payment from Medicare and that's it? There's no additional billing to the Medicare patient? But for a private healthcare person, you will submit to our private carriers for the full amount with an expectation of being paid the full amount. And as we all know, that the movement of healthcare is the high deductible HSA plans. So there will be an out-of-pocket expense more than likely from the healthcare savings account to an individual who's not a Medicare. So you're accepting the Medicare payment, but you're not going to accept the full bill out to a private individual. I think that's the point that
Yeah,
but you've been doing that. It's no different.
Yeah,
It's
no,
no
it
different.
doesn't change.
Right, but it's no
Yeah.
different. So
Usually the privates, so the privates usually follow what the government does. So the privates usually negotiate with billing agents and things like that, different rates.
but you don't have a
From
capitated
things
rate.
like that.
You don't have a
Right, they get
capitated-
billed, here's the state rate, this is what you
That's it.
billed, and then what they pay, depending on, who it's Aetna or whoever.
But you're still going to expect from a private individual who is not a Medicare or anything else, you're going to expect the full payment. Arbitrarily, let's say $1,200. So you're going to expect that $1,200 from, if you come to me, and you're going to expect my healthcare provider to provide that. But my neighbor who's on Medicare, and not they are, I'm just saying that.
Sure.
But is going to be billed $1,200. Medicare is going to reimburse $435. You're willing to accept the $435 because we've gone into this agreement to pay the $1 per resident, correct?
Correct.
And in years past, you've been eating that cost of that difference in the Medicare. So there is no change. It's always been this way in that the people with private health insurance are been paying the full boat. One other question I have is what Middlesex Hospital, is it similar to what the Yale or Hartford Hospital is doing in Hartford County or New Haven County? Do they provide paramedic services?
No, Middlesex, Hartford and Yale do not provide any kind of paramedic service. Middlesex Hospital has this hospital-based paramedics, L&M Hospital has it, Wyndham, and Norwalk.
So similar counties, some counties, the regional hospital is doing it, and some are not. Is the practices you're following in the regional hospitals that are doing it, is it similar?
It is similar. Wyndham's is a little different. They charge $1 per capita, plus they charge a per patient fee, so it doesn't matter what you have. They also have a billing agreement as well, so they have that same type of billing agreement. So they charge a $1 per capita fee, they charge a per patient, a contact fee, and then there's a fee if they're canceled, and then there's other fees that they have. But it is a similar thing. They actually charge more, but it is a similar type of makeup. But they do charge $1 per capita.
Additional question on charging it. Most people, I never got clarification, I was going to look up, who of Medicare have a supplemental. Do you charge against the supplemental or just more $435 and that's it?
The supplementals, I think if they have supplemental insurance, if there's anything left, that's what it would go
So if
to.
you have a Medicare Advantage plan of some type,
Right.
then you guys are recouping the full cost.
That
I
would
thought-
recuperate if the person has that.
What I was trying to determine, I thought it was, does the healthcare reform act fee.
No, I don't think it requires you to have it, no. But a lot of them are probably 80%, so.
I would say, yeah,
It's
our
automatic
business.
even that, yeah. Yes, ma'am.
So here's my question. If you're on Medicare, Husky, Medicaid, you are not going to be back billed.
There's no change, so no.
I'm asking, so are you gonna be back billed for the balance?
In general, no, I don't think it would, unless you, no. It changes nothing, so it wouldn't,
So those people aren't paying now?
no, not, no. It depends on, I guess, what the plan is and everything. I'm not an insurance expert, I'm a paramedic, so I can't speak to specific plans, but nothing's gonna change, there's no.
So Medicare patients could still get billed then, is what you're saying?
No, I'm not saying that at all. They operate under this, we have this bundle bill, and that's, they get
So they're
billed
not gonna
from
get
the
back billed
ambulance, goes through all that and everything. No, there's gonna be no bill that's gonna show up on a Medicare patients thing that says Middlesex Hospital Paramedics, here you go.
I think the issue is that some people are having is that $1,200 for services for the paramedic, you accept whatever Medicare pays. The question is whether they're having the same situation if their insurance only covers 70% or 60% or whatever.
Sure, no, it's totally understandable. And this is no different than if you go to the pharmacy or the doctor's
Yeah.
office or the hospital or anything else. This is just another part of that. And I'm not saying from an insurance standpoint on how that works, it's fair, because I pay those same deductibles and everything else, and I don't get ambulance service for free or any of that. So I understand that that's what's coming out of your pocket versus others. But that's, for Medicare, how it works is the government gives you what they give you, and that's it. There's no, that's it. That's all they allow you to do. And you either accept Medicare or you don't. And there's places now, we're not looking at doing this, but there's places now that have decided to not accept Medicare anymore because of all the rules and regulations. And they do other billing tactics. We're not looking at doing anything like that, but that does happen because of those reasons.
I will say that when the service started, there wasn't any bundle billing, and they were having significant issues of getting any money for any services from any insurance company.
Yeah, and back then the ambulance system didn't bill.
Right, so it was a real issue, and that's one of the reasons bundle billing came along, because they would only recognize bill from the ambulance and not paramedics. It sounds basically, that hasn't changed in 30 years.
No, they haven't changed it. They've
Gone back.
put up more red tape and things and made it tougher for the patients.
Couple quick questions, Jim. You're dispatched to a call, the technicians get on the scene and say, no, it's really, we don't need your services. You don't bill, or do you bill?
No, we don't bill per call.
You don't bill?
Not like that.
You don't bill?
No.
Now, you get to the scene and the paramedic assesses it and says, there's no reason for me to go along.
Yeah.
Still no bill.
There is a bill.
There's a bill at that
There's
point.
an ALS assessment charge. That's
Okay,
the state.
but that's as an ALS2?
No, it's a separate thing they call ALS assessment. that
Okay,
the state
that's just an
puts on
assessment.
their list, yeah.
Because early on, there was no charge if they ended up not going.
That's, well, yeah, that's not going in the paramedic.
Yeah, but I mean, they get there and
assessment,
say,
they're
nah,
two
nah,
different
nah,
things,
nah,
yeah,
nah,
right.
right.
Right, correct.
But that has changed, okay, I've been out of it a little while, just going back, did you say the average bill for paramedic services, and I don't know if it's ALS2 or 3, was $1,200?
The billing rate for the combo for the bundle bill is $1,288.
$1,280 for the combo, that's for the ambulance and paramedic
For the
service?
combo, an ALS1 regular is about $970 million.
Okay, and Medicare is just paying you, if you bundle bill, and we'll say, I know it's by mile and everything, depending on where you are and whatever, but we'll say $400, you're getting
About $74.
$74. You're in a hell of a business.
What's that?
I said, you're in a hell of a business.
I just want to add, that's the same thing for any Medicare patient there. The government, as Jim says, sets the rate for any procedure, and that's all that could be billed to the provider. That's all they're going to get paid
Then
for.
the private health insurance company works the same way. I don't go to the doctor's office and a $300 bill, my health insurance company doesn't pay it, they pay him $125.
Right.
So it works like that for every.
But they don't have to-
insurance company.
They can bill upon it depending on
Not
your
if
plan.
not if they are contracted with the insurance company, they can't then bill me for the difference.
That would be capitation, then that would be capitated with a PPO plan.
So they
But
have
if
to
they're open with a know.
They don't
just
accept my
say-
insurance, they can bill whatever they want, and pay
Right,
whatever they
that's
want.
right, right.
Most places will accept insurance so that they get paid at all.
But Medicare will bill the patient for the balance.
They
They
can.
absolutely do.
They can, but the insurance, but Medicare itself is only gonna pay that set amount for that particular procedure.
Right, but then the
with claims
patient's
within.
responsible for the balance.
If the doctor wants to bill for that, some do and some don't.
Then why is
You
the
know,
I
ambulance
haven't
then
done one
gonna
that
bill
hasn't.
for more than they accept?
They're willing to eat that, they're willing to eat that.
But only for the Medicare patient, not
Right.
for the private person with private health insurance, which is the same thing, just a difference in age.
Right.
So why do the old people get the benefit, and I gotta suck it all up and pay the $5 over the course of 5 years, my taxes go up percentage-wise because I have to pay all this money? Who thinks I have extra money to spend?
Well, it's the same for any procedure, though. The doctor doesn't have to bill the additional costs above, you know,
Alright, so let the
procedure
Medicare
for.
people deal with their own ambulance bills, let me deal with my own ambulance bill, and just let it go. Why does the town have to get involved?
So that brings up the question, you haven't done this before. It's because the additional tax that the state has put on the hospitals?
It's the big
But-
push.
Does the hospitals use to cover this cost, or that you got grants from the state before?
I'm sorry, back up. No, so this tax is, yeah, something that we've not done before. We don't get grants, we're not eligible for state grants for paramedics.
Well, I don't, when I say you, I mean the hospital
For state
for your
grants.
services.
Right, yeah, so this loss has created an obvious burden for the hospital to keep functioning, so they've had to look and see how they do business. We've had a ton of cuts and pullbacks and constricting over the past 3 years, really, not replacing positions. We've had a total of 3 vice presidents, or 2 in the past few months that have left, that they're not replacing the positions or filtering out their jobs to other VPs or directors or whoever. And they're just changing the way that they're doing that and looking at and replacing stuff. Because they don't want to take services away from the community in different offices and programs and things. So they look at things like ours. The hospital has over, I don't know, it's like 65 different community benefit programs. And this one is the most expensive by far, even more than the cancer center. Does that answer your question?
Yes.
Have we entered into this contract at this point?
Yes, we have.
So it's a year. It's you can get out anytime. There's a clause that you can get out, and it's done by year. So it's not like you're in it and that's it. You're done.
Well, apparently we are in it, and that's it.
When do you assess the population? Because we're not at 9,000 anymore, so when does that?
It's written into the contract of the census of it's worded into it that they'll use the census so they know what numbers to expect.
The last official census, or
They used it 2010, and that's what the select folks wanted. It was, yeah. Well, actually, that's what originally we had said the public health one, but the towns wanted to use the government census for 2010. Everybody wanted to use that, so.
Yeah, COG recommended strongly that we all join this year. COG is sitting there, and we're talking about it. I've been up to the, call it board, or
Yeah, so we formed what we did is we formed an advisory committee made up of select folks and chiefs of service or representatives from each town. And we meet quarterly and we go over numbers and statistics and anything that the towns want to know from our finances, how we're doing, how we can improve finances, how we can drive the cost down, and hopefully reduce any increases in next year or whatever, so we can keep it at maybe $1 going forward instead of going to 2 to 3, but to look for more creative ways to make us more efficient in the community, and by doing that, we're going to need the chiefs of service help to use us more efficiently and to reduce costs like fuel and stuff like that. So we meet, we just had one meeting so far, we had our first meeting, and we're going to be meeting each quarter going forward to go over that stuff.
So what happens if my family's visiting, my mother's on Medicare? We have to call the ambulance, so she becomes part of this $1 thing?
Yeah, because the agreement's with the ambulance service, not with each individual patient. Well, the $1 thing is just, I guess, kind of an umbrella, but yes, ma'am.
How many towns do you serve?
We cover a total of 19 towns.
And so far? Just Deep River?
So right now we have Deep River. I've talked to Bonnie Rhinesmith in Old Line. We haven't had theirs yet, but they've already committed to it and said they've got it. And Cromwell too. They have a new fire chief, and their fire commission actually are the ones that do their stuff like this, I guess, any kind of emergency management things. And we also have that committed from them, and they're sending it. They haven't received invoices though from the hospital.
But Middletown and Portland didn't sign on.
Right, Middletown, Portland, Middlefield. They're covered by Hunter's ambulance, and we have an agreement with Hunters that they pay us. It's a different agreement because it's a totally different, it's a higher volume, different patient makeup, and they pay just differently. They pay a per call basis on that up there, which down here they wouldn't be able to do.
As an aside, are you a paramedic for the East Haddam ambulance company?
No, with the hospital.
Do you know if the East Haddam ambulance company has a response time? A required response time?
I don't know if they have one set by the town.
Are they set by the state?
So they're not set by the state, but what I can tell you is that every municipality is supposed to have an EMS plan, and they're supposed to do that every 5 years. And that's something that's been written down for a long time, and lots of folks just said, okay, and didn't really go there with it. But they've really bumped up the volume on that in the state and have required it from all of the municipalities, and have sent letters to each town selectman and the fire chief, ambulance chief. And what they want is that plan, which includes that information of what they want in their town to hold the first responders, police, ambulance, everybody responsible for. So that document would really be, and I think East Haddam's is probably coming up soon because they started at the beginning of last year really pushing it, and they're going alphabetically as far as I know, because I know I got a letter sent up from Chester, Clinton and stuff, so they're
You should be able to get that from the chief
probably
of service for the ambulance.
If they can't respond, they do mutual aid with Colchester or Old Line.
Well, I had a
If
neighbor
an
call
ambulance
East
side
Haddam
line.
ambulance, 45 minutes, they didn't show up, they had to drive him to the hospital.
Yeah, that happens to us all the time when Charles had his allergies.
I would think that at that point you would have to pay the bill.
Keep us included.
Do you know the response time for the ambulance company?
There is no designated response time.
But there will be.
There's a goal.
That's just there's a plan that the town discusses, and
I think all towns have similar issues with response times. They're all volunteers and
Yeah.
who's available when.
How fast can they get there? What can they do? They do the best they can.
in your town, I used to live for a few years, I owned a house on Algonquin Trail, and this is such a massive town. Just the challenge of getting to some of the roads is tough to get to Sheepskin Hollow or something if you're coming from over there or whatever. So that in and of itself, even if you're sitting there in the driver's seat, it can take a long time.
And you can have 2 or 3 calls at the same
And
time.
that always happens. That's Murphy's Law is always there for that. Yeah, that's the question. Everything happens at once.
If you did not get a response, who has said that no one ever came?
No one came. 45 minutes, no one came. So they
Should
drove
have
to the
been
hospital.
contacted, someone should have gotten hold of you from dispatch and explain what's going on, but
Remember I called you
That's
from
not-
home and drive Charles?
That's very bad.
You got home before.
Is that with KX or Valley Shore?
Don't
What-
ask me.
I think
where do you live?
Mount
Well,
Parnas.
that's
Oh.
not anymore now. It's all about the show.
It's all about
I
insurance.
think,
Yeah.
if I remember correctly, I think they used to tone the ambulance 2 or 3 times. If they didn't get a crew,
This was in the last month.
they went to an adjoining town.
Yeah, so I'm not an expert on your system, but I know they
Right.
do have a protocol for several tones to go out, and then they flip it over to mutual.
I'm not, I mean, from what I understand, they have very few mutual aid, so they had one the other day, but I'm not sure why that was. I think one of the rigs was out, they couldn't get another crew.
We've
But-
gotten pretty bad on that. And
In the past.
It's much improved. over
Yeah,
the
there's
last
very few problems, plus you also have the paid staff on during the day now.
I think wonderful. Everyone all set now? I hope you understand because
It's a lot
put
of.
it far better than I can.
Sadly, there was people that thought for the $9,000 there wouldn't be any more bills
Yeah.
for
I
paramedic
wish,
services.
I wish.
The way I was explaining.
All that did was to make it the way it was. And whatever was happening before is happening now.
That's true, but there's a lot of people that somehow thought that this was not going to.
That was never,
It's gonna raise the bills.
I see it as the $9,000.
it's, you know, if we don't pay it, frankly, nothing else will change for anyone except the Medicare people. But they're gonna get hammered.
Right.
And for the moment, you know, when it gets up to $45,000, I think we're gonna be looking at a whole lot harder.
I hope we look before it gets to that point.
I'm sorry?
I hope we look before it gets to that point.
We are looking now, COG is looking, that's why we're participating up there, going up there to talk to them about what can we do, how do we do it, and we're looking for better answers. And you know something? At $45,000, I hope there's a better answer. At $30,000, I hope there's a better answer. And this is a year-to-year. This is not a 5-year contract. And we also, within the year, I believe on 90 days' notice, we can withdraw from it.
Is there a penalty to withdraw?
I'm sorry?
Is there a penalty to withdraw?
I'm not aware of that. I didn't say anything in the contract.
When did we sign it?
I'm sorry?
When did we sign the contract?
Actually, it was due in June.
So we signed it in June,
We signed in July.
so
So
the 90 days is up.
No, you can give notice.
90
Give
days.
notice.
Just as long as you have 90 days
You-
notice.
Yeah, at any point, we can give 90 days' notice.
August 24th.
You'll sign in August?
The August, there we go.
But then again, back to before though, if anybody has a Medicare Advantage plan, if we were not in this, it would get covered also. So it's really benefiting people who just have straight Part A and Part B, not anybody who has
To
that
the
supplemental.
greatest extent.
Yeah.
Uh,
But as I said, I agree, it's ridiculous for those people, for the seniors who don't have
I mean, those are the
supplemental.
those are the ones who would be injured the greatest by having to pay this.
You're talking about life-saving services
Right.
that you're providing. Somebody has to pay for it.
The more likely those people could
Our
afford,
ambulance personnel cannot do basic procedures, and a person could die because of that.
more likely the people who don't have an Advantage plan probably can't afford it. So they can't afford it, they can't afford this on top of it, so it's a good insurance for that.
I see the calls
Yeah.
on my phone
And
all
so,
the
yeah,
time. 48 WF Palmer
yeah,
Road.
all the time.
That's where we're going.
There's a lot of challenges that, from what you were talking about before, when this all started, the system in general is pretty much the same of independent services. Every town's got a certain amount of resources and things like that. And, you know, maybe, hopefully during these, and it's really proven not to be and that's how it's on everywhere. It's not, or at least in most of Connecticut. Because Connecticut is a very volunteer-heavy state, because there's the quiet corner, and there's a lot of areas that are even more remote. And so that's that structure. But through this committee and having all these select people involved and business people and others, that, you know, maybe we can put together a different model or look at some different things that would drive the cost down, and not just this, but of local services as well. Because it was very clear at the meeting that there was other select people that had pretty big concerns about their local costs, because they're now paying for crews and things like that. Some of them exclusively pay out for labor.
But fundamentally, what the issue is, and it's not just unique to this, is Medicare has not adjusted their rates, and it's not paying enough, and it's not just for this, but it's all type of services. So I don't know how we tackle that other than dealing with our federal elected people to get on the Medicare Association to increase payments out for services.
Right, and we hope to, that's a huge thing to do, and that's a David and Goliath, but we hope to start that conversation, that movement, because again, there's other, you know, this isn't the only place in Connecticut, and so this impacts a lot of people, and especially if it's going to impact seniors. There's a lot, you know, the demographic in the state, there's a lot of seniors in the state that, you know, could have a voice to help the government look at that again and change the way that they distribute that, because it's expensive for the government too if they're not doing it efficiently.
Are we all set now? I feel like we've beaten this to death.
Thanks for coming out.
Thank you for having me. Appreciate it.
Thank you. Thank you so much for coming
Thank you.
by.
Thank you for having me.
Take care. Have a good night.
Stay ahead of that. I get a special double dose with it.
Yeah.
That I have it, boy, it's really interesting what it does. received this today, just to make you aware. Wednesday, October 26th is going to be an informational meeting here. And what apparently is underway, and this is something that was started last spring, is horizontal curve treatments on local roads. The state has federal money and there's a considerable plan in place to label what they feel are dangerous or difficult corners all through the town, private or your public roads that belong to the town, not the state, with all of these signages that you see now on 149, the chevrons, the zigzags, and it's a fairly lengthy list, some of which when I saw it, I went up and I talked to Beth and I said, is this really necessary? You've got stuff going in on Foxtown Road, you've got stuff on Haywardville Road, considerable amount of it, Hemlock Valley Road, Honey Hill Road, Maple Avenue, Mill Road, Tater Hill, and a bunch of others. And they're going to be doing, if you can see that, I don't have anything to hand out, but it's the yellow signs, bright yellow signs, with a post with the reflectors on them all the way down. Right down 149 below the falls, that sort of stuff, all through the town.
So this is the second cut from what they did last year?
Yeah, this is,
Can I see it? Can I see the?
this is it's a considerable program.
And who's paying for it?
It's federal money paying for it.
Who pays for the replacements when they get smashed?
I have no idea. Perhaps the guy that hits it. But just to be aware, on the 26th of October, in this building, 7 o'clock, they're going to have a hearing, so you can voice their opinions. Moving on to my report, Board of Assessment Appeals, Penny's here. We asked you to do the report.
Sure. We meet twice a year. We meet in March and we meet in September. September, our meetings are only to deal with automobile appeals. This September, we had 11 applications for appeal. We acted on 10 of them. Of the 10 appeals, we reduced the grand list by $17,920. I think you probably will have tax refunds I see on the agenda later, so that will be the impact of on the,
What you've done.
to find out the dollar amount that the town is out. You multiply the 17,920 times the mill rate. It gives like $500. By state statute, applicants can appeal to the Board of Assessment Appeals if they feel that they've been overtaxed. What's happened in the last several years is people are keeping their automobiles longer and longer because of the high prices of new vehicles. So consequently, the cost of, or the valuation of automobiles has not decreased as significantly as it had in the past. People get their tax bills and looking for a way to save some money. And if you drive over 10 or 15,000 miles a year, you can bring in evidence of that fact, and there's a formula that's in the blue book that we use to reduce your assessment of your vehicle.
On the other side though, do we tax older cars that are considered classic?
There's a state limit on that, isn't there?
Yeah.
It used to be $500. I'm not sure what it is.
So that 59 Corvette that's worth $1 gazillion is still taxed as a 50,000.
It's just like the state does not tax boats, but they tax the boat trailer.
Yeah.
So you can have a $100,000 boat on a $1,000 trailer, and you're only paying taxes on the $1,000.
The key to that, and having an old car, I'm aware of it, is that they have to be registered. If they're unregistered, they get taxed at the value. If they're registered, they get taxed at the 500 or whatever.
You mean registered as a classic car versus a regular registration?
I'm sorry?
You register as a classic car or an antique car versus a regular registration? Yes.
And
But those cars are only allowed to drive so many miles per year too, aren't you? No.
some of them don't drive at all. Mine hasn't been out of the garage in 10 years.
That's all insurance.
The roads aren't wearing out on me.
No,
But anyway, that's,
So what's the conclusion?
okay. Aaron, anything on that?
Nope, good.
Okay. I included a fact sheet on NIMS 100. NIMS is a National Incident Management System. And after what happened on 9/11, with the lack of coordination all over New York and confusion that took place, it became very, very apparent that we had to have some sort of a better organization. And they came up with a NIMS program, which is a National Incident Management System. It's kind of a pyramid that can grow or shrink. You can do the county fair with it, and it's a way of organizing all of your resources and making sure everything's under control while you do it. Or you can take, we used it for Irene and Sandy here out of the firehouse, and it worked wonderfully, and it's expandable all the way up to a national level if you need it. Very good program. What is required is that certain individuals, including selectmen, are required to take training with that. And the NIMS 100 and 200 are available online. Take about 3 hours each. And it acquaints you with what the process is, how it's laid out, what it does. Then you've got the 300 and the 400, which I believe are both required to attend a class. And then the 700. That's what any selectman is expected to do. And I just bring it up now because we have a potential hurricane coming at us. I've taken all the courses. I dug my stuff out. There's a little quick and dirty NIMS book that kind of reviews the whole thing and puts it all in a little bitty package. And started reading that, and started reading through some of the other stuff I had. I've done it a while ago, and I've forgotten an awful lot. I saw how well it worked during Irene and Sandy. It really was what kept us going, was how we made it happen. And I was wondering if we weren't about to walk into that again, so I said I'd better get ready. And it made me think about it, so I wanted to bring it to your attention. And
It recently took, what was it, 700? Was that,
Pardon?
I used to have the 700 down,
Yeah, exactly.
down in Essex. So I was such a.
And that's when we had to attend it.
Yeah.
Now, the 100.
I didn't realize it was online, so I can take a look at these.
Take a look at it. It's pretty straightforward, and you can work on it, walk away from it, come back, and continue working on it. And you do learn an awful lot, and it's, as I say, it's technically required. I know an awful lot of people haven't done what they're supposed to, and it's not a big deal.
Yeah, they mentioned you can't get grants, some grants.
Grants
if you don't.
start getting a little sticky,
But they
they come in to see who's taking it,
Right.
and you have qualified people. That's one of the reasons that I finished the book. But I just wanted to bring that to your attention.
So you don't have to, excuse me, you don't have to do 100 and 200 before you go to the next level?
It works best that way. Obviously.
But apparently you don't have to go that way.
He took 700 and it would work.
Someone was actually the entry level one that's instructor led. It was led by the person who did who's the head of our region, what are we, region 2? Remember? Was it 700?
I don't recall.
I can't look at my calendar.
I can't remember everything.
So that would just seem a little.
It was just August.
Yes, is that in essence kind of
Yeah.
how often?
Yeah, the 1, 2, 3, 4 build on each other.
Yeah,
So you really want to take those in order. I don't remember what the 700 was all about,
but there was people, there was Board of Ed, there was people from
Exactly.
Selectmen, there was firemen, there was ambulance people. I think some of this was the general overview of NIMS. It was about 3 hours.
Yeah.
It
is that just a one-night class?
was one night, yes.
That would be an overview. The 300, I think 400 took about 4 or 5 weeks, maybe 5 weeks to finish it. And you're there once a week during that time. Anyway, going on from there, citizens' concerns. Anything out there?
I just have a quick question. You said that the Leos are doing the petting zoo.
I'm sorry.
The Leos are doing a petting zoo on Saturday. You said you gave them permission to do that at the last meeting?
Do which?
The Leos,
Yeah,
you gave them permission to do a petting zoo at the
yes.
Apple. Are they using their own pets or are they hiring a company to come in and do that?
I am not aware that they were supposed to be small animals of no great consequence.
Do we know if they're vaccinated, if they have insurance, if somebody gets bit at a petting zoo? I mean, small children are going to be
Do you recall what
holding
that
them.
was all about?
Do not.
I believe they had a commercial one coming in, but I'm not dead sure. But there it is. Any other concerns?
What's the status of the Bone Mill Bridge again? Have we approved the contract for that, or we're still?
For which bridge?
Bone Mill Road, down in Haddam.
Yes. We have a plan. I don't think the contract's in place yet. I haven't signed anything on that.
It's gotta be the WNC still in the final design phase. They just had a public hearing not that long ago, and I think everybody was
month and a half
happy with
ago.
it. So they have to go through and complete the design, and then they'll have to go out to bid for construction. So the design company will have to prepare the final documents for bid.
So is there gonna be any other final meetings, or I'm sorry, I was tied up with other activities, so I wasn't able to get to
I
that.
believe that was the last public hearing, because that public information meeting, because they already had two. And they really only usually do one, but they agreed to do a second one.
There's a great deal of enthusiasm about it. People like what they saw. So they're pretty happy with what's coming down.
I get all that, but at $35,000 a linear foot, it's pretty expensive. And they could have accomplished the same thing with a similar bridge with the same surface, and I think the people would have been just as happy with it, but they didn't give them options, and I think that's unfortunate.
Anything else? Okay, unfinished business. Shagbark. I did get a figure, and I believe you got it there, Ernie.
Yep.
For what the building department has been doing, about $1,550. And that's extended it right now. Nothing has changed as far as the lawyer side of it. And my understanding is still moving forward, and we'll see where it goes. They've got until June 10th, 2017 to start using electricity. If not, we've got recourse at that point, and we'll see what happens. We've seen the paramedic report, the Middlesex report from Jim. It was very good of him. I'm grateful he was there. Moving on to new business, East Haddam Police Department private duty form. And this is, take a look at it. The comment at the top, as approved by the East Haddam Board of Selectmen. And apparently this has been, I don't know if it was ever approved to begin with, way back when. To my knowledge, it's not come before the Board of Selectmen, and it was some confusion. They cleared up some things on it, rewrote it a little bit, and then changed the numbers or the email where this was to be reported to. Forms being mailed, emailed to. And it was a non-town email address, which meant that we weren't maintaining any kind of a record. That wasn't good. And the fact that they had changed the form, and they apparently changed it 2 or 3 times, and I sat down with them and said, first of all, you're creating a lot of confusion the way you wrote it. I said, let's take a look at it and get it so it's absolutely clear what's going on here. I said, let's get a town email address on that, where stuff's going to go to, where we maintain records, we know what's happened. And then let's bring it before the selectmen and actually get it approved, as it's supposed to be. And so that's what we're doing here tonight. It reads much better at this point. They've revised it, and there it is.
Question I have, and maybe I should know what this is, on the latest form, what is a GP? Time work shall include on-site plus
That's-
1 hour GP.
That's general preparation.
Okay.
No, it's
They
not, it's general
always
patrol.
included that.
It's called general patrol.
I'm sorry?
It's called general patrol.
They call it general preparation to me, and I've also heard it called general patrol. But it's basically the opportunity for them to address, get prepared, get in their car, and get to wherever the job is at. And so patrol or preparation works either way. But it's clear now, much clearer. It was driving Dawn crazy the way they had it written. She couldn't understand what was happening. And I said, we've got to make this so it works.
Who sets the rate? As we go on, it's going up. The channel, I think, go up. But how is the rate determined that it's $47.50 per hour and all these other fees?
Can you tell me how that rate is set?
I don't set it, so that's set, it's either by their, I don't know if it's their time plus time and a half, or, you know, if it's their time plus the 15% administration fee, you know, plus then they add the $10 for the car.
Charlie,
If I may, I believe the rate that you're referring to is all contractual. You have to look in their contract, it'll spell out what they get paid, and it should break it down. Last time I looked at it, it breaks down all their pay, full-time, part-time, overtime, and overtime special events, and that, it's all contractual.
That's something I need to take a look at as the contracts, and I just haven't got to those yet.
so the numbers are not pulled out of the air that we want.
No, they're not just arbitrarily throwing them out of the air, it's contractual.
But our prior ones, okay, half hour GP, okay, so it is a little,
It changes year to year.
Yeah, it changes every year, and I can see that looking back at old forms. But the thing that bothered me the most on it was, it hadn't been approved by the Board of Selectmen. I said, you know what, it says so right on the top, that's how you do it. And don't give me a form that I haven't approved.
and also be concerned, that's a Gmail address, that's a public, that's somebody just went in and created a Gmail email account. And things were going to there, so
Yeah,
where,
the old one.
yeah, so where is that information? Is that gonna be transferred to?
They claim they have that available up there. I said, we want it on a
Yeah, how about what's in that mailbox now, what's in that public Gmail account?
Yeah.
Is that gonna be transferred to the easthaddam.org account?
It should be.
Should be.
Will we're gonna ensure that they do that?
That's a good point, and I will.
Because those are public
Better
records.
It's all public,
Whose
right?
email is it going to, that if it wasn't a town email?
easthaddamot@gmail.com.
So who owns that email?
That's a good question. If somebody just went on, I could have, you
Why
could
do you
create.
think it was a problem?
Yeah.
We saw that, and you can't do that. There's a limit, guys.
Somebody created it, created a shared mailbox that a handful of people had access to. And
Police departments like to run their own show, and you kind of have to watch closely and check.
Yeah, you have rules and regulations and you have compliance people, but you really can't do something like that. Most police departments, there's somebody overseeing it, so that can't happen.
And that's, well, right now there's somebody overseeing it. Because we looked at it and said, no, isn't going to happen. So in any case, down here, respondents from news.
do we need to make a, are we going to vote to accept this form?
That's where we're going.
Okay.
I'm going to make a motion to approve the changes in form as presented.
Second?
Any discussion?
But you don't know where the rate is coming from, so you're approving something you don't know where the rate is?
Well, we know it's contractual.
We know
Okay.
it's contractual.
All right.
All in favor?
My no stipulation on approving it is that any prior form is to be transferred off of that Gmail account into the town.
Okay. I've got a note to that
Okay.
effect.
So with that, aye.
Okay. Lots of surprises. Lots of surprises. Okay, coming up next, bid award. We went out and looked for evaluation at 4 different contractors, actually 5. And if you look at that, the 5th one, Tyler, was utterly outrageous in what they were asking. I'm not sure, but that's one of the ones where we could get it, that's great. If we don't, we got plenty of other work. At $334,000. We had Northeast Evaluation, Equality, Vision, and Municipal Evaluation Services. Remaining municipal evaluation was at $245,000, which was still very high. Vision, whom we've used in years past, was at $195,000, Equality at $180,000, and Northeast Evaluation, the basic bid was $163,000. Ed was on that committee along with myself and Mike Gross and Loretta. I think that was the ones who were involved.
And Cindy.
I'm sorry?
And Cindy.
And Cindy, of course. Looked at it pretty closely, and what Loretta came up with, 5 bids submitted. Bids range from $163,000 to $334,000. A committee consisting of Emmett Lyman, Cindy Verrecchio, Ed Blashik, Mike Rose, and myself, Loretta, reviewed the bids and interviewed 4 of the 5 companies that submitted bids. The committee rejected the bid from Tyler Industries because it was quite over budget. Of the 4 companies interviewed, the committee selected Vision Government Solutions. Although it was not the lowest bidder, overall it provided the most service for money, including tech and legal support. When calculating the cost of future maintenance fees, it came in slightly lower than the second choice, Equality. The 2 other bidders, Municipal Evaluation and Northeast Revaluation Group, would use the Vision software, raising questions about who would provide tech support, online access. Equality would require a conversion. And the Equality, in spite of being quite low, by the time we did the conversion and worked with them, they became very expensive. And on top of that, they thought they could do the whole project with 1 representative in town. And you know what, we're too big for that. You can't get away with just one guy going around and doing all the appraisals. You never get the job done, or you'd be doing it so fast and so poorly that it wouldn't work out well. So in the end, we looked at it. We've used Vision in the past, and once you added the yearly, the 5 years, and the yearly fees that were involved, and various other prices, Vision came up the best, and that's where we feel we use it. We know they do a good job. They worked for us before. They're very, very presentable in terms of what they were offering, their legal help, their support. You know, everything's right there where it needs to be. So, any discussion on that, Ernie?
Oh, that's Vision appraisal, so, yeah.
I think that's the right decision, is where we want to be. And I'm going to make a motion to award the bid for reappraisal and evaluation of real property to Vision Government Solution, Inc. in the amount of $195,000. Any discussion? Second first.
Yes.
Any discussion?
Nope.
All in favor?
Aye.
Aye. Okay. Ed, thank you. Your insight is always a great value.
Good decision.
Board commission changes. Okay, we have a board that's a little strange to me, East Haddam Schools Capital Improvement Building Committee. As I understand it, this is a standing committee so that when you have relatively minor things coming through for the school that do need a committee, we can refer to that committee, let them deal with it, and then give us their advice, and give the school advice in terms of what to do, how to handle it. The alternate would be to have to form a new committee each and every time you need to put up a chimney or do some sort of minor work at the school. And by having the standing committee, we do a much better job and a much quicker job for them. And just so you're aware of it, the original charge was in 2000. It's resolved that the East Haddam School Capital Improvements Building Committee is hereby established for the first purchase of completion of the following projects. And they give a list: electrical upgrades, roof replacements, asbestos tile, window replacements. And then as we have something, we come in and amend this and let them continue to work on the next one. 5 members appointed by the Board of Selectmen. They don't receive compensation. They're authorized to have the following powers: consult with the Board of Ed and its administrators concerning plans and projects. I find it interesting that I wasn't aware of this committee, that it existed at all. To review and approve all set plans for such projects, to provide the Board of Selectmen with estimates, to file grant applications where available. It's a general purpose organization. To develop plans, drawings, and on completion of the project, we'll make a complete report and accounting to the Board of Selectmen. So it's a very useful group of people who stand ready to serve the town when they need it. And we have a opening. It says a regular member, and Craig Greensfelder has volunteered to come on board and join them in what they're doing. And I'm going to make a motion to appoint Craig Greensfelder as a member of the East Haddam School Capital Improvements Building Committee.
Second?
Any discussion?
Nope.
All in favor?
Aye.
Aye. Thank you, Greg.
For volunteering.
Okay. And tax refunds. Oh, goodness. You did quite a bit of work. I guess I can do this in one shot. I'm going to make a motion to award tax refunds. The amount is presented: $30.52 to Peter Albright, $76.31 to Nathaniel Barrett, $151.45 to Casey M. Carl, $65.15 to Cameron Keir, $26.71 to Mary L. Newth, $48.72 to Dean Paladin, $188.72 to Joseph I. Smith, $61.64 to Kathleen L. Willie, $601.93 to Ralph Parody. Second on that? Okay. Any discussion?
Nope.
All in favor?
Aye.
Aye. Okay. And once again, public comment. Yes, sir.
I see that banner is reapplying again for, have they paid their fees from the last time? Because I had asked,
For what?
they didn't pay their fees from the last time. Have they paid them yet before they're submitting again?
I believe that they're being required to take care of what they owe before they can move forward.
But it's moving forward, it's already going forward, I mean, he still hasn't paid them.
That's what I'm saying, those have to be paid before they go any farther.
But we're still having the meeting on Tuesday with Banner.
I'm not on planning and zoning, so I'm not familiar with that.
I understand, but we just bailed out one developer with a road, and now we're letting another developer who hasn't paid and it's falling apart over there to resubmit again. So who's gonna hold these people accountable? I mean, we're just bailing everybody out.
I'm not aware that we're bailing out Banner in any way, or intend to. But once again, that's planning and zoning, we have to talk to them about it. That's their purview, not mine.
They said it's not their issue, so I'm coming to you because whose
Planning
issue
and
is
zoning
it?
said it was not their issue.
Whether he's paid his fees or not, it's not their issue.
Okay.
So whose issue is it then?
I am not familiar. If you would like, I will get the information, come back next time and report.
I'd like it if you could before the meeting, the public meeting on Tuesday.
You're speaking of what, the planning and zoning?
Yeah.
Yeah. I have, if I can get there, I'll get there. I like that meeting, I enjoy it. I was there for a long time, but I have a lot of conflicts now.
I understand it, but if you look at his businesses, most of his businesses aren't in good standing, and according to the tax assessor, she fills out the form for him when he forgets to. So,
Run that by me again?
the owner of Banner,
Yeah.
according to the tax assessor, he doesn't file his form, so she does it for him.
Mhm.
So, we're allowing him to keep going, that place is falling apart over there. It's a mess, if you take a drive through there, it's not luxury condominiums anymore. And he's not maintaining what he has, and it's empty. So, and he hasn't paid his fees, so why are we letting it go forward, is what I'm asking.
Okay. Once again, that's a planning and zoning issue, I'll go and talk to them about it. We have small town government here. And because of that, each board and commission, elected board and commission, answers to the Secretary of State. They don't answer to the selectmen. And I will go in there and suggest and ask if they do certain things. But a good way to get your head handed to you on a plate is to try to tell them what to do.
Well, they should be answering to the citizens.
And you know what? I can make an issue of it, but I can't tell them what to do. That's not allowed. Small town government, we had a charter, we could do what we want. But this is a format of government that the state of Connecticut established long ago. And as long as we remain small town government, the terms that we serve our offices are set by the Secretary of State. Our elections are all handled by the Secretary of State. Every board and commission answers to the Secretary of State. And I learned that a long time ago. That the selectmen doesn't have the power. Not over wetlands, not over planning and zoning, not over the Board of Ed, not over the Board of Finance. We don't have the power to tell them what to do. We can suggest, we can lean on them. We do that. And I certainly will look into this and find out what's going on.
Yeah, because he had all kinds of conditions the last time that he hasn't met still.
I was on the commission when they originally put that together. And I watched it fail and fall apart back in 88, 90, that era. And I don't want to see it do that again. We don't need an eyesore and a problem in this town. We got too many of them already. So, as I say, I will go and talk to them, I'll find out what's going on. I will suggest as strongly as I can what ought to happen. And lacking that, it's their call.
What forms is he not completing?
Tax forms, according to the assessor,
What would be an example of a tax form?
whatever businesses fill out.
Personal property.
Oh, okay. So it's his profit and loss statement that. So he doesn't fill them out, then we should fine him. You don't fill that out, you fine the person.
You would think.
But whatever you have, if you could give me the details on it, what you know. It'd make it that much easier for me to ask the questions I need to ask. Right now, I'm going to say what's going on at the Banner.
I'll forward you all the
Why are
emails
people
about in the
complaining?
morning.
So please send it to me,
Yeah.
let me take a look at it, and I'm no happier than you when I see crap around, pardon the language.
No, they spray painted a bunch of the things over there black because he was supposed to fix them, and then the construction company didn't get paid or something, so they left. So now on top of the buildings falling apart, they look like graffiti, black spray paint on doors, decks, sides of the building.
I haven't been up there in 10 years, I'll have to take a run through and see what's going on. That sounds like it's something that needs to be paid attention to.
Are you talking about the buildings in the back there that are totally rotting into the
No,
ground?
these
Oh,
are
that's
units.
another whole issue.
Yeah, these,
Well, on that same vein then, you say it's not your responsibility, but I think if the town is aware of buildings that are significant hazard, even if they're on private property, that there's some liability for the town, because you have buildings right there that are open. Last I knew, they were open, and you can walk into them and fall right from the first floor into the basement into 4 feet of water. The floors are rotten, the doors, I mean, you can walk, there's no doors, or the windows were there and they're gone, so you have a number of buildings up there that are in an extremely hazardous situation, so.
As I say, I haven't been up there in a long time, it's time I took a look.
And you can't see those from the road, you have to go for a walk. They're back in the corner, and I know that kids have been in there, and there's evidence, people have been in there, which is a scary thought because.
Past the maintenance building and the pond, continuing past there.
So you get to the circle, you go to the
Yeah.
right,
Yeah,
and then
Behind the
when you
driveway.
rotate the hard left, you keep going straight up in there.
behind the driveway.
Yes.
Yeah.
Yes, directly
Are
behind
those-
the driveway.
Are those old resort buildings still? Are they
No, no, they're homes that were built and never occupied, and they have now, because they didn't keep the water out of the basements, and the windows have been stolen or smashed, and the doors have been removed, and it's just it's a significant public safety and
Well, that was,
health issue, to me.
You're the liaison to planning and zoning, so.
hate to bring it up, that was what our blight ordinance was probably gonna try to attack.
That's not on the blight list, because I have requested a blight list so I can go out and look at them. And try to
This
see
is just
what we
happening,
can.
I'm
I
sorry.
said, you're planning and zoning
Yes.
liaison, so.
Yes.
I mean, you have the right to ask them.
So if I understood correctly, Terry, I'm supposed to talk to the chair, made the accusation that they have not paid their permit fees for their planning and zoning application. So that's what you're gonna look into, is whether they paid their
Well,
fees.
that-
For the last
well,
time, for the last time.
Last time.
You know that for a fact?
I asked Jimmy for proof of it, he said he would send it to me when he got it, I haven't received anything.
I thought that was paid when I was to one of those meetings. I thought they made him pay that one before they would take that last application that was withdrawn.
I asked for proof of
I think
it.
that was one of the conditions once it was withdrawn, but it could be some.
Let's find out.
Yeah.
That's all I'm
we're
asking,
doing
I'm
now
not
is
just asking for
speculate.
the proof if it was.
All we're doing is speculating now, so let's find out, and then we'll find out what we can do, what kind of influence we can have on it. And you know what, I certainly am good at complaining. So I'll do what I can. Just like you, I don't like it. I don't want that out there.
And maybe we can get Jimmy up there, land use then if these buildings are in.
He's been up there, he was up there with the septic issue all spring. Jimmy's been up there, he's seen the condition.
Then the building department should do something, or somebody should force them to be boarded up at least to keep out kids and everything.
You know, if it's become an attractive nuisance,
Yeah.
that's a legal liability.
The residents had asked for it, the residents had went before the WPCA looking for help with the septic and the buildings up there, and
Let me get up there and find out what's going on, because all we can do is just thrash you forever on it and not resolve the thing. And I have kind of a personal view, or interest in it, because I was there when those were put up. And I was part of letting them happen to begin with. And what are we gonna do?
Can you also check into, when you're checking into whether or not they paid their prior permit fees or application fees for this new 247 units, that they make sure that those fees are paid before?
Well, I can assure you one thing, they're not gonna get COs until the fees are paid.
Well, we make
They
sure
won't
that
sell
they
it.
pay their fees before they start building.
Yeah, I mean, that's all part of the package. Let's
And I
go
don't know who
now.
I would address that to, but if you're looking into it.
I mean, I'm gonna check it all out, find out what's going on, and I can report back next time. And here's where we're at.
thank you.
Just can't do more than that. Hey, anything else? Okay. Ernie, you got anything?
So just remind you, I will not be at the next meeting, so
You will be away for the next meeting.
Right.
Okay. We'll have Sue next meeting.
Yeah.
Okay.
Is Sue gonna be in Napa next meeting?
No,
I know, I
he was
thought it was
missing next meeting.
Right, and she's
She was
missing the following
the meeting after.
Afterwards, right,
She's not November.
right.
That said, you get a motion for adjournment?
Second.
All in favor?
Aye.
There we go.